you think that's one of the stigmas against psychiatry? Like that there's there's so many diseases that don't have effective treatments, but in reality, it's just you probably don't see because socially people don't talk a lot about their mental health if it's being well managed, although that's improving.
Yeah, I mean, it's partly the way we learn in medical school. I guess that there are very few really quick, effective treatments in psychiatry. That's where you can, just remembering back to sort of general medical days, the extreme the extreme gratitude you get from inserting a catheter into someone with urinary retention.
Exactly.
The extreme relief and immediate fix that is there.
Temporary,
It's temporary, but it's there. And there's very few treatments in psychiatry that work like that.
That's a good point.
And as a medical student, mostly what you get is snapshots of medicine as you move through rotations.
Yep.
And most psychiatric treatment takes a lot longer to work.
Yep.
And, say in the really complex cases you get, say, in the forensic hospital, it can take years for someone to be on their road of recovery. But it's really effective in the long run. And so you see that, and I think that's, so maybe that's one element of why psychiatry is stigmatised. The best explanation of this I've seen is actually from a lawyer, a legal scholar in America, who writes about the concept of sanism, which is like a saneism.
Saneism, right? The opposite of being insane.
Well, it's the irrational prejudice against mental illness.
Oh, right.
Okay, like the other irrational prejudices of racism or sexism or homophobia or all the kinds of irrational prejudice that we can have. It's sort of interesting that becoming mentally ill is one of the things that can happen to anybody.
Yes.
So
I often think about that. If I could become like this patient, and it can happen to anyone at any time. Yeah,
and so that in fact makes perhaps the prejudice much more strong, and rather than there's makes it more a sort of visceral fear that we all have of perhaps becoming mentally ill ourselves.
Yeah. So you try and create the distance. You try and other them.
Well, I mean, I think like the best example I give is if say you're walking through a big park in a major city and you see someone who's obviously mentally unwell and homeless, and just watch how people's gazes avert or their roots avert from that person. So I think that there's a very powerful fear that we all have of mental illness, and that then transfers onto the people that try and look after people with mental illness, and so that probably sticks there to a way.
Hey team, thank you so much for checking out that highlight clip from the Doctors Getting Coffee podcast that I run. If you want to see more clips, you can check out my YouTube channel, or if you want to listen to the whole thing, check out your favorite podcast app. If you want to support the podcast, consider buying us the next coffee at buymeacoffee.com/Dr. Sil. You can also join us as a YouTube member or a Patreon and get access to the full video podcast episode. Or you can just jump onto our Discord server and we can chat one-on-one. Thank you for your support, and I'll see you in the next video. Bye for now.